Hello and welcome to the CalPERS Health Benefits webinar for state members, which includes California State University members. Our agenda will cover several topics including the types of health plans CalPERS offers, eligibility and enrollment, making changes to your health plan, COBRA, and CalPERS Long-Term Care Program. We'll also cover the various resources available to you.
Let's start with who is eligible for CalPERS health benefits and identify the different types of plans available. CalPERS health benefits are available to all state and California State University, or CSU, employees. They are also available to public agency and school members whose employer contracts with CalPERS to offer this benefit. In this webinar, we'll cover information on health benefits for state and CSU members only. There are three types of health plans offered. First is the Preferred Provider Organizations, or PPOs. As a PPO health plan member, you get maximum benefit coverage when you use the network of physicians and hospitals. The plan allows you to select a primary care provider and specialist without referral. You are responsible for a certain coinsurance amount, and the plan pays the balance up to the allowable amount. Next is the Health Maintenance Organizations, or HMOs. An HMO is a plan that provides care for specific doctors and hospitals under contract with the plan. While you pay co-payments for some services, you have no deductibles or claim forms to deal with. HMOs have a geographically restricted service area. The HMO provides a list of primary care physicians to choose from who will coordinate all of your care, including referrals to a specialist. The third are the exclusive provider organization plans, which offer the same covered services as an HMO plan, but you must seek services from the plan's network of preferred providers. Our PPO plans include PERS Care and PERS Choice, which are available worldwide, and PERS Select, which is only available in California. These plans are administered by the Anthem Blue Cross.
Our health maintenance organizations currently include Kaiser Permanente, Blue Shield of California, Sharp, United Healthcare, HealthNet of California, Anthem Blue Cross, and Western Health Advantage. Kaiser is available in California and select areas outside of our state. The other HMOs are only available in limited areas.
Our EPO is administered by Blue Shield and Anthem Blue Cross, but are limited to certain counties. There are also association plans which are only available to members who pay dues to these specific associations. You must continue paying dues after retirement to keep these plans. The plans offered include California Association of Highway Patrolmen, California Correctional Peace Officers Association, and Peace Officers Research Association of California.
Now we'll cover eligibility and enrollment. There are basic requirements that most state and CSU employees must meet to be eligible to enroll in a CalPERS health plan. One is that you must be appointed to a state position that will last at least 6 months and 1 day, and the other is that you must work at least half-time or more. You have 60 calendar days from the date of your initial appointment to enroll in a plan. Your coverage becomes effective the first day of the month following the date your completed enrollment form is received. Only one election is allowed during the 60-day period. The rules are a little different if you are hired as a permanent intermittent or limited term employee. If you are a permanent intermittent employee, eligibility is determined within one of two control periods. The 6-month period from January 1 through June 30th, with an effective enrollment date of August 1, or July 1st through December 31st, with an effective enrollment date of February 1. You cannot be eligible in the middle of a control period, even if you met the minimum hours at the beginning. If you are a state limited term employee to be eligible, you must have served in excess of 6 months and you must have worked at least half-time to be eligible to enroll. Check with your personnel office for further information about health eligibility if you are a limited term or permanent intermittent employee. For CSU coaches and lecturers, you must be appointed for at least 6 weighted teaching units for at least 1 semester or 2 consecutive teaching quarters. You may also have dependents on your health coverage. Dependent coverage may include your spouse or registered domestic partner, children up to the age of 26 who are natural, adopted, or a stepchild. A certified disabled dependent child over the age of 26 can stay on your plan if the disability occurred prior to the age of 26. Or if a parent-child relationship exists, such as a grandparent with custody of a grandchild. If you have dependents currently on your health plan, they'll continue to be covered after you retire as long as they continue to be eligible. Any dependents that are eligible but not enrolled at retirement may enroll within the 60-day retirement window or during any future open enrollment period. Dependents may also be covered after your death in retirement as long as they receive a continuing monthly benefit from CalPERS and are eligible for health benefits at the time of your death. So if you want an eligible dependent to continue their health benefits after you pass away in retirement, you need to be sure that they are eligible for a monthly benefit as a survivor or as a beneficiary based on the option you choose at retirement. A common question we hear is, will I have health benefits after I retire? And the answer is, it depends. There are requirements for continuation of health benefits when you retire. To be eligible, you must retire within 120 days of separating from your CalPERS employer. For example, if you separate from your employer at 45 years old, which is too young to retire, then later apply for retirement when you're first eligible at age 50 or 52, you would be outside the 120 days and no longer eligible for health benefits. You must be eligible for health benefits on the date that you separate, and you must receive a monthly retirement allowance. Health coverage eligibility and the cost of your health plan may vary depending on where you live, the health plan you choose, and the length of your employment, which is what we call vesting. Vesting is the amount of time in state employment needed to be eligible to receive employer contributions towards the cost of your monthly health insurance premiums during retirement. Upon retirement from state employment, the state may pay an amount towards your health insurance premiums. The amount of the state's contribution you are eligible for is based on when you were first hired by the state and the amount of service credit you've earned. The amount of the state's contribution is determined each year by taking an average of the premiums of our four most popular health plans. Because it's an average, the premiums for some health plans will be more than the state's contribution, others will be less. As a result, even if you qualify for 100% of the state's contribution, you may still have a deduction coming out of your retirement check for your health coverage. Now let's talk about how health vesting works for state employees. You can see from this slide that if you were hired by the state prior to January 1, 1985, you'll receive 100% of the state's contribution towards your premiums. If you were hired by the state on or after January 1, 1985 through January 1, 1989, you'll need 10 years of CalPERS service to receive 100% of the state's contribution in retirement. If you have less than 10 years, the amount you are eligible for will be prorated based on the amount of service credit you have. For example, if you have 6.7 years of service credit, you would receive 67% of the state's contribution. Note that the 10 years in this situation can include public agency and/or school time as long as you retire from a state employer. If you were hired by the state after January 1, 1989, you'll need to have 20 years of state service only to receive 100% of the state's contribution towards your health benefits premiums in retirement. If you have between 10 and 20 years, you'll get 50% for 10 years, plus an additional 5% for each full year completed. So for example, 15 years will get 75% of the state contribution. Note that in this scenario, the years have to be time working for a state government employer only. School and public agency time do not count towards state health vesting for this time frame. If you are hired under Bargaining Unit 12 on or after January 1, 2011, Bargaining Units 9 and 10 on or after January 1, 2016, or Bargaining Units 2, 6, and 7 on or after January 1, 2017, then it takes 15 years to get 50% and 25 years of state service to become fully vested for 100% of the state's contribution. Finally, if you retire from a California state university, your vesting percentage is automatically 100% no matter when you were hired or how much service credit you've earned. Medicare and your CalPERS health benefits will need to be coordinated. Automatic coordination can occur if you enroll in Medicare at least 60 days prior to your 65th birth month. will send you a notification 4 months prior to you or your dependent's 65th birth month. Included in this letter will be an ineligibility of Medicare certification form, which must be completed if you're not eligible for Part A, either in your own right or through the work history of a current, former, or deceased spouse. You can also note whether you're deferring Part B because you or your spouse who carries you on their health plan are still actively employed. If you are not eligible or deferring, you stay in the basic plan. If you enroll in Parts A and B 60 days or less from your birth month, then you must provide proof of your Medicare enrollment to us. Provide us a copy of your Medicare card and a completed certification of Medicare status form. It's important not to ignore our notices. If you fail to enroll in Medicare by your birth month, then your health plan will be canceled the first of the month following your birthday. Also, Medicare will assess penalties if you delay enrollment. Review the CalPERS Medicare Enrollment Guide, which you can find on our website under Forms and Publications. This book outlines everything you need to know about coordinating your benefits. You can find more information about Medicare eligibility and enrollment at medicare.gov.
Now let's go over ways you can make changes to your health plan. If you need to make a change to your health plan, there are 2 ways it can be done. The first is during open enrollment. The open enrollment period is held in the fall of each year, with changes becoming effective January 1st of the new year. Changes include switching health plans, as well as adding or deleting family members. There are also qualifying events that allow you to change your health plan outside of open enrollment. Some examples are getting married or entering into a domestic partnership, the birth of a dependent, or a divorce or dissolution. Also, loss of coverage due to being canceled as a dependent from someone else's health plan, and moving or qualifying events. While you are actively employed, the health plan you choose can be based on either your physical home address or your work location. Our next topic is the Consolidated Omnibus Budget Reconciliation Act, or COBRA. COBRA allows continuation of health coverage if you lose health benefits due to separation from your employer without retiring. It's also available to a dependent child who loses coverage when they turn age 26. You must submit a COBRA election form within 60 days following notification of eligibility. If you are active, this form must be submitted through your employer. Once retired, it must be submitted to us. Coverage must be continuous, and you will be required to pay the premiums from the date your coverage ends. Your premium will not exceed 102% of the group monthly premium rate. You also have the option of purchasing your own health coverage through Covered California. Now let's talk about your dental and vision plans. It's important to note that these plans are not administered through CalPERS. For state members, it's through the California Department of Human Resources, or CalHR, and for CSU members, it's through the Chancellor's Office. Your collective bargaining unit determines which plans are available to you. There are 3 types of dental plans offered for state and 2 options for CSU employees. First is an indemnity plan, which is available throughout the United States and worldwide. The plan sets the limits that the state will pay for each specific type of dental treatment. You are responsible for any remaining balance. A monthly premium copayment also applies. This plan does not use a provider network, and you are allowed to select a dentist of your choice. Then there are the prepaid plans, which are available only in California and require you to use a dentist from a specific list of doctors who contract with your selected prepaid carrier. Most basic services are covered at no cost to you. The preferred provider plan is also available. This plan sets the limits paid for each specific type of dental treatment. You're responsible for paying any remaining balance. Eligible CSU employees have indemnity and prepaid plans available to them. The Vision Services Plan is available to state and CSU members as well. The VSP Basic Plan is paid by your employer while you're still working. Your eye exam copay is $10, and you have a reduced cost for lenses and contacts. Once you retire, you are responsible to pay the full premium to continue your coverage. The premium can be deducted monthly from your retirement check as a direct authorization. The VSP Premier Plan provides more benefits, but you are required to pay a monthly premium, whether you're active or retired. For more information about the vision and dental plans offered, state members can go to CalHR's website at calhr.ca.gov and select the Salary and Benefits tab. For CSU members, you can find more information about the plans available at calstate.edu.
Now we'll introduce the CalPERS Long-Term Care Program. The CalPERS Long-Term Care Program is the nation's only voluntary, self-funded, not-for-profit program helping to protect assets and lifestyles against the catastrophic cost of needing long-term care services. It's entirely funded by member premiums. The CalPERS Long-Term Care Program is available to all CalPERS public employees and retirees. Most family members are also eligible, even if the employee who makes them eligible doesn't apply, including spouse, child, grandchild, sibling, including step-siblings, parent, including step-parents, nieces, nephews, aunts, uncles, parents-in-law, sons-in-law, daughters-in-law, brothers-in-law, sisters-in-law, or grandparents. You can find information on the various plans, the enrollment packet, and answers to frequently asked questions by visiting calperslongtermcare.com. Or you can contact us by phone Monday through Friday from 8 a.m. to 5 p.m. at 800-908-9119. We also offer a long-term care video which can be found on our CalPERS Network YouTube channel. We have several resources available if you need more information regarding health benefits. Our website is a great resource that provides you with more in-depth information on eligibility and enrollment, available health plans, and rates, along with the CalPERS Long-Term Care Program. Under the Forms and Publications section on our website, you can download or view the Health Program Guide, which covers basic and Medicare health plan eligibility, enrollment, and choices. The Health Benefits Summary explains the differences between HMO and PPO plans. The Evidence of Coverage publications review the terms and conditions of coverage, including benefits, covered services, and the copayment information for each plan. And the CalPERS Medicare Enrollment Guide covers how Medicare works with your health plan benefits and when you need to enroll in a CalPERS Medicare plan. If you are moving, you can use the health plan zip code locator on our website to check whether your health plan is offered in the area that you're moving to. If not, you'll need to change your plan. Once you know what plans are available, you can do a side-by-side comparison using the Health Plan Chooser tool. Even if your health plan is offered in your area, you'll still need to update your new address so that we can update your health plan. As a reminder, while an active employee, all updates must go through your employer. Once retired, you can contact us to make any changes. In your own My CalPERS account, you will find the Health Plan Summary page, which provides information about your medical plan, the coverage type, when you were enrolled, and your premium. At the bottom of the page, you'll find your subscriber information as well as a list of any dependents enrolled on your health plan. New this year is your open enrollment page, which during open enrollment you'll find your current health plan statement, including rates for the new year and premium information for other plans. As an active member, you'll still need to contact your employer to make any CalPERS health benefit changes. If you're retired, you can make any open enrollment health plan changes from the open enrollment page. We went through a lot of information today. Our presentation today was intended to provide you with the information about CalPERS health benefits. Remember, this was a brief overview. You can find more detailed information on our website and through the publications we recommended. Thank you for taking time out of your day to attend our webinar, and have a great rest of your day.